sculpting, we're gonna do some enhancement on her face to get her more sculpted and defined. Look how youthful she looks, with that cute smile. We want that smile to be enhanced. And what are we gonna do? We're gonna give her just a little bit of that signature heart-shaped look, right? We talk about this with women. We want it to be elevated through here and curve downward as we move towards the chin. But notice that she's starting to get some folds. She's a busy mom, takes a lot out of people's faces, so it makes this area drop earlier in life. So we're gonna do some filler on her folds. We're gonna bring this cute chin forward, and then she already has a lot of volume in the cheek, so how do we make this look better without it looking overdone and cheeky? We work a little bit posteriorly to lift this area. And then lastly, what's the best thing? What's our cherry on top always?
The
lips. We gotta do the lips. All the girls love the lips. So we're gonna start a little bit of the chin. We're gonna use some Juvederm products today. We're also gonna improve some dark circles under the eyes, because every mom out there knows how tiring it is to not only have a job, but take care of their kids, which is also a job. I can't do it. I can barely take care of my dog. So we're gonna go all the way down to bone. She's got a nice muscle here, so we wanna go below the muscle into that space that allows us to really lift. Just look at that little projection already. It's cute. So what do? We draw a line between her nose, lip, and chin. We've now hit the perfect projection. So now we're gonna move on to the folds. Was that painful or no? I guess if you're smiling, it's not too bad. Little pinches. I'm telling you, women are queens when it comes to doing filler. They can take no matter what. You guys typically cry a little bit. So with folds, we're going to do a traditional. We're going to go all the way onto the folds. And as we move upwards towards the piriform, you want to be careful in terms of blood vessels. So we're going to kind of do sweeping technique. We used to call it fanning into this area just to get a softer look and make it more even and natural. Typically you need about a syringe a side to really get a nice improvement. When we did the clinical trials years ago, you typically did about a syringe a side to see about 70-80% improvement. We're going to go to the other side now. I'm going to switch my team. Look at the difference. That is to show that, because you can see a huge difference in the fold. Look at the fold one side, look at the fold the other side. How amazing is that? This is old school treatment of folds, but sometimes it's important. It's okay. People are seeing you on Instagram. So again, when the folds are more deep, we have to get a lot in 2 different layers, superficial and deep injection. There's other techniques you can use, like a pillar technique across the fold, or even a depot technique. I just find that this is more natural in look, especially when she smiles, giving a lot of support to the piriform at the right depth, a little more superficial, just kind of blending it into the area. There we go. Softening the folds really takes a nice improvement. Now, we don't typically do this as much nowadays because we're doing more sculpting, but certain people are candidates for this. She has heavier cheeks naturally and stressful work-life balance, so causing a lot of droopiness to the central face. So this is going to allow us to soften that area. Switch sides. So I threw in an extra syringe because I really want to highlight her lateral cheek. She has nice big cheekbones. But every girl loves when they put on makeup and this area pops. What also this does is it gives a little strut to give support to the lateral cheek, so it pulls everything up. Show that from the side now. You can really see the projection there. Such an amazing result. And not even flinching.
I had a whole baby.
You had a whole baby, exactly. Can handle anything. Super mom. Awesome. Okay, so we're going to switch back. Now I'm going to use a different filler. Just so you guys know, I don't tend to use Juvederm products under the eye unless it's Volbella. But I want to give her a little more volume. So we're going to use Bellatero. We're going to do this in a very And this sort of older method where we do these little baby injections more superficially all along the trough. We just blend the area. And this is going to give her just a little bit of height and just a little bit, perfect, of blending here so she doesn't see the dark circles as much. Perfect. Okay. So kind of hold over there. And that's going to give her, look at the improvement there. You can see here you see more of that ridge. Here you don't see the ridge. You're doing great. Again, little baby injections. This is a different type of filler. It's injected more superficially so it blends into the skin. So initially it will look a little more sort of whitish in discoloration because it's blending, but then it perfectly blends into this, to the area. Excellent. Okay. Now you guys can see those dark circles. They're gone. Bye. So now let's do the best part, the lips. So I'm gonna do the lower lip first in my traditional sort of pillar technique. And we're using regular Juvederm here. So this is gonna be amazing for her lip. You guys will see the volume she's gonna get because regular Juvederm will improve the volume substantially. And what's the one thing you notice as people age? The wrinkles that form on the lip. And that's because it loses hydration. By adding volume like a hyaluronic acid, you get hydration, which leads to plump and shape. Amazing, amazing. Very good. So now, a little more tilt. Over. Perfect. We're going to come from the top. And let's define out that Cupid's bow. She already has a really beautiful lip shape. Let's just get it to be a little more. With regular Juvederm, using a little smaller of a needle, so it's a little harder to press. Same thing on this side. Are you saying anything there, Jordan?
Not yet.
They've been going viral lately with acne scars, so they don't know what to say for filler. Okay, let's take a look from the front. Ooh. So with her, I want a little bit of a pillar here. I want these Velcro columns because I think it's just going to make her lips stand out a lot more. I want her to look more sexy from this lip injection. So this can add to that sexiness right there. Go right on the border to the other side. Almost done. You guys can see she really needed that volume. There was a lot. It was dehydrated, very dehydrated, her lips.
Allison said she needs more.
Allison, we'll see you in what, 3 weeks?
Yeah.
Excellent. Allison's one of our New York clients who gets amazing results and wants to post it every time. Very good. All right, so let's do our first reveal, okay? That's gonna be the Emer reveal. Do you know what that is?
No.
That's when we give you the phone, and in this position, you look at yourself. Now, some people will cry, and most people are happy. Hopefully you will be. It looks really amazing. Doesn't even look like there's any bruising. Way more shaped. Under eyes are improved. Give her the phone. Let's do the Emer reveal.
Alright, here you go.
All right, take the
Grab
phone.
Grab it.
Take the phone. Show everybody. What do you think? Come closer. Come closer. Yeah, let it go to you. Let it go to you. What were you looking to achieve? What did you want?
I want all of this.
So we lifted the cheek a little bit, didn't touch any of the volume here, just softened the under eye, the folds in the lips, and look at the chin. Turn your head to the side a little bit. Look at that.
Wow.
Balance. Look at the proportion of lip to chin, and look at the cheek lifting. You see that contour? What do you think of the softening folds?
Oh, that's like,
Huge difference.
yeah.
Night and day. I love it. So now, come a little closer, start rolling your lips too. Oh my god, you look so good.
I know,
You look
it's
like
nice.
literally like a model. It's
I
insane.
had like full lips already. This just
Wow,
looks like.
looks really good.
Yeah.
All right, well let's flip it back.
But look, the folds are gone. Wait,
Gone.
hold on. I want to see.
Bye.
Wait, I want to keep looking.
Keep looking, keep looking. No, not you. The folds. I was thinking
know,
right at
they're
the folds.
Fine. Thank you. This looks amazing. Oh my god.
Okay, now lay back. Just lay back and relax. Relax. Take the mirror. Same thing. Hold in 45 so you can see your face in 45. Now, what do you think?
Fantastic.
You look so young already, but doesn't that just give you that contour
Yes.
and that nice shaping that we were really going for?
Mm-hmm.
Okay, so pan, show them, Jordan, what female facial sculpting, natural feature enhancement looks like. You're gonna look, your lips are gonna look a little off because there's numbing inside.
Okay.
And then that's it. Wow, it looks good. It actually sure made a difference.